Good morning, everyone. Today is Thursday, December 14th. Thank you so much for joining into our weekly HCR webinars. I appreciate this busy time of year that you take a few minutes to join in and learn the latest on the products and what's new from the carrier perspective, as well as in Washington and locally as well. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL, and I oversee the group markets and individual markets in Pennsylvania. If you are new to the format, there's a few ways that you can ask questions, and questions are definitely encouraged. I can't answer them all because I don't know everything, but if you ask a question, I can certainly do some research and get back to you the following week. So just with a show of hands in your electronic hand to the right of your screen, if you can let me know if you see my screen. Yeah, good. There we go. Awesome. And this is how you would raise your hand if you wanted to ask a question live, or you can type in your question in the question box at the end. So let's start with the agenda here. Well, first of all, we have a new PowerPoint presentation reflective of our new logos. So Sarah made this up for us. I think it's pretty special. But here's the agenda. First on the list is the tax bill. Many of you probably have heard already, but the committee reached an agreement in principle on the combined House and Senate tax bill. The votes are expected early next week and included not only everything else with the corporate tax rate, everything else that is addressed in the tax bill, but this combined bill does include the elimination of the individual tax penalty, and that would be for 2019. So, it's kind of interesting. It will be interesting to see how this really affects what the carriers deliver to the market. But if there is no tax penalty for not having individual qualified coverage according to government standards in 2019, then I suspect that the whole market is going to be opened up where you can look for plans that are less expensive, that meet the needs of your individualized clients. I know not all of your clients need maternity, not all of them need in-hospitalization and mental nervous. So all of those essential health benefits that have to be in the plans now will no longer have to be in 2019 if the tax bill is signed and not altered from this point. But I am encouraged. There is no change, unfortunately, to the applicable large employers as far as requirements, reporting, and the penalty for not offering coverage. So, I guess we'll take our small victories, but, within the group market, the 50-plus market where the penalties start, a lot of those groups already have established health plans. They already meet the qualifications, and they're already affordable by government standards to the employees. So again, the fact that that was not eliminated is a bit of an issue, but nothing that's insurmountable for sure. The local legislation, Pennsylvania House Resolution 4575 was introduced to remove the agent compensation from the medical loss ratio. If you recall, when the ACA was signed, they had an MLR for small group and individuals. That meant that 80 cents of every premium dollar had to be spent on claims in the small group market and individuals, and 20% or 20 cents of that premium dollar would go towards administration, any expenses, and agent compensation. So if that's eliminated, of course, if the tax penalty itself is eliminated, then I would say that the metal levels and everything else should eventually go away. But this was nevertheless introduced, and it's certainly a step forward in loosening up some of the requirements in the actuarial values to allow agent comp to be hopefully a little bit more lucrative. BlueCross, moving on, Capital BlueCross Group, January 1st new business cutoff for URL is 10 a.m. tomorrow. So please be mindful of that. Honestly, we could make the deadline at midnight on the 15th and it still wouldn't be good enough. So I just want you guys to be aware of that cutoff, be mindful of it. We will do everything that we can, but if we get it after 10 a.m., there's no guarantees we can get it to the carrier before the cutoff, and that would mean that they'd have to go with a February 1st effective date, which nobody wants to happen. So again, please be mindful of that. January 24th at URL, I talked about this before. Gino Gambardello is coming in and going to do a lunch and learn for us of the advantages to reference-based pricing. That starts at 11:30. Again, it's a lunch and learn, and I think this is so timely. A couple things happened to me this week. I have a medication that I needed to get. I have an HSA, and I got a good RX coupon for my medication, which was just about $20. So went to pick up the med, and because I had insurance, it had to go through the insurance, and it ended up costing me $74. So with reference-based pricing, it really, it doesn't have a network. It's all based on a certain percentage above Medicare. So it opens up, again, the market to have consumers really be smart shoppers and more in charge of their health expenses. But bottom line is it's not a network product. You're not locked into the network, which incidentally bumps up the pricing. You know, ultimately you spend more on a PPO than you do in out-of-pocket with a reference-based pricing. So for those of you that are in the group market and have heard about reference-based pricing or want to learn about it or learn more about it, I would encourage you to register for this lunch and learn on the 24th, because you will absolutely walk away with some new ideas for marketing groups in 2018, but also you'll walk away with certainly knowledge in this ever-changing industry. And I believe that this is going to be certainly the way of the future. Speaking of group, don't forget that we offer complimentary Federal Cobra, a summary of plan documents, benefit notices if you write your group business through URL. So that's nothing to you know, just overlook. It does come with some clout for you and some servicing clout, if you will, for your clients, when you can go in and say that you will handle their Cobra, and you know, it's a benefit of doing business with you. You will handle their wraps or summary of plan documents and benefit notices that are specific to the group and specific to the group size, and it keeps everyone compliant. So I think that's a huge advantage, a huge value add, but you can advertise it as your own and hopefully gain more group clients. Individual open election period ends tomorrow. That's a good thing for many. It's kind of been a distraction with the way the individual market has, you know, kind of opened up or not opened up, you know, progressed in Pennsylvania. It's definitely a distraction for all other lines of business. So I personally am glad that it's done tomorrow, but I do think that it's also an opportunity to talk to your clients about the Christian Health Share Ministry plans, you know, even changing from an ACA plan to a Christian Health Share Ministry plan. And speaking of those plans, it's imperative that you listen to the 101 and 201 webinars and do your homework, because it's a specialized program, and the last thing I want anyone to do is get in trouble by selling this product as, you know, a price-only saver. It comes with some restrictions that you absolutely have to let your clients know before they sign on the dotted line. So the webinars, 101 is on our website, and the 201, if you have listened to the 101, you let me know and I'll send you the link for the 201. And that's pretty much it. That is our open forum now where you can ask questions. This is me. Great picture, huh? So let's open it up for questions, and let's see. Oh, Jim asked for the latest commission schedule, and Jim, would you believe that I just removed it yesterday? So I will email you that separately, and it will give you the commission structure for the individual plans. And Vivian says, is there anything about CHIP that you know of? I don't. I know that it's still able to be sold. It's still being funded. Of course, it's kind of in this twilight zone where it's there, but the funding will be running out. I know that there was supposed to be a temporary spending bill that didn't make it through. I cannot see that the CHIP would not be reauthorized. I think it's just kind of going through the political machinations until somebody says, okay, enough of the posturing, let's get this done. But I can't see that it's going to go away. But at this point, there's not been any funding approval to have it continue. And Pam says, was with a client and joined late. Can you briefly review the ending portion of the webinar? Okay, let's see what that was. I talked about the individual open election period ending on 12/15, that's tomorrow. I talked about our complimentary Federal Cobra offering, summary of plan documents and benefit notices, and of course the lunch and learn for the reference-based pricing, which is a huge opportunity for those of you in the group business to learn about the reference-based pricing and to start marketing it. Pam, if you have any additional questions, you can reach me after the webinar. So that's it, folks. Those are all the questions we have. Hopefully everybody found it informative today. As always, I truly appreciate everyone joining in, taking your time in this busy season for this last push of the 1/1s. I wish you all a great balance of the week and a wonderful and blessed weekend. Bye-bye.